Ask the Doctor by GPDQ. Expert medical advice for you, your family and your colleagues.
Hi, I am Lucas and I look after corporate healthcare at GPDQ. I have our clinical director on with us today, Dr. Katharina Chrysalis, and we're going to talk about social health and well-being in 2021.
Thanks, Lucas. I'm so excited to talk about this topic actually, because I think people don't talk enough about social health and well-being and actually might even not know exactly what it is. So I think it's a great topic for us to bring to our discussion today.
Excellent. Well, let's get started with what is social health then?
Thanks, Lucas. So I think that we know obviously what physical health is and we know what mental health is, and a lot of effort has been put into boosting awareness of mental health, and quite rightly so. But actually, social health is also very important in your overall holistic health. So the WHO, which is the World Health Organization, their definition of health and good health is a complete state of physical, social, and mental well-being. So social's in there as well, and not merely the absence of disease or infirmity. So they focus on those three aspects, so physical, mental, and social well-being. And as I said, we focus a lot on physical and a lot on mental, but not enough on social well-being. So social interactions have obviously played a huge role in our last year, and we've seen what goes wrong, with ourselves mentally and physically when people are not able to interact in the ways that they would have normally interacted. And I think it's important to talk about. Maybe we should have spoken about it earlier more, but we should speak about it now that things are opening up.
So do you think that has boosted the importance of it basically in our lives? Is that your view on that as well?
Yeah, so COVID, I think, has brought to attention how important social well-being is. So, for example, if you consider the lockdowns, you've got two types of people basically. You've got a spectrum of people, but really two general types. So somebody who might be introverted, for example, they might have experienced the lockdown and gone through it in a way that was a lot easier for them. They might not have found working from home difficult, working via Zoom. They might have actually thrived in that environment and done well and better at work and felt more comfortable. Whereas somebody else who is perhaps more extroverted, them being at home and not having the social interactions that they were used to and that they really worked for them, that might have been more difficult. And a lot of people obviously have felt low, or that's led to anxiety or depression. We know that during the lockdown. So that's an example of how differences in your social personality actually can impact on your mental health. And we don't ask enough, we don't talk about it. So during this lockdown, for example, mental health awareness has been spoken about so much that if someone was to ask you, how are you feeling today, it wouldn't be so difficult to say, do you know what, I'm actually feeling stressed, or I'm feeling a bit low. But how many people would have said during that time, do you know what, I'm feeling lonely? I don't know if many people would have spoken that much about their social health and well-being, because it's not to the point where we speak about it with that ease. Yeah. So that's the difference. And obviously feeling lonely is one example of when your social well-being isn't working for you. That can lead to mental health problems and then also physical health problems. So there's an interaction between all three of them.
I totally cannot agree more. And in your opinion, sort of how will social health change post-lockdown?
So I think that this is actually a difficult one, and I think we need to consider this going forward, because obviously we've had some lifts to the lockdown yesterday, and that's great. It's means that our physical health is improving as a nation. We're getting COVID under control. It also means that our economy is going to get back on track. But going forward, we're saying that come June, the majority of all the lockdown restrictions are going to be lifted. So rewind to those two people that I spoke about, one who's introverted and one who's extroverted. The extroverted person, as the lockdown restrictions happen, they might be they might be very excited, they might not have any reservations, they might be at every stage, they might have already been to the pub garden yesterday and had their beer with their friends. That might be something that they were very comfortable with. But then the introverted person who actually got comfortable with being at home, they might still want to see their friends, but perhaps they're a bit more concerned, or that's not going to be as easy for them, or they're concerned how they meet up.
Mm-hmm.
And having been alone for so long, we've developed, or some people may have developed, anxieties about being in groups or meeting in certain ways. So as much as it's great that we're lifting these lockdowns, I think we need to consider how we do it on a way that everybody is comfortable with.
Yeah, and on that note, and considerations for protecting sort of everyone's social health and therefore the mental health and the physical health, what can we do about it? And how can we protect ourselves and others around that? And I think in particularly sort of around the employment scene as well, like how employees look after their social health when they return to the office, in fact, because that's what's happening now.
I think that actually it needs to be dealt with on a delicate basis. So, on an individual level, if you're meeting up with somebody else, it might just be worthwhile considering, is that person as comfortable as I am with the activity proposed? So as the lockdown lifts, it might just be a good place to start with saying, what are you comfortable with? Because if you consider somebody who, even somebody who used to be extroverted, they've been in that position where they've been in lockdown. Perhaps they've seen other people having COVID, they've got concerns about their physical health because they maybe have physical health problems, and they really want to meet up in groups. But maybe because we don't talk about it enough, are not comfortable to say, I'd love to meet up with XYZ people, but can we all wear masks? Because, people might take them off in a group, or I'd love to meet up with XYZ, but I don't want to meet up with the full 6 because I feel a bit uncomfortable with that. So I think it's just worthwhile being aware that because one person is comfortable, everyone may not be. Because if you consider the person that meets up in a way that they're not comfortable with, that might lead to mental health problems. Or equally, if they don't go to that event because they're uncomfortable with the social interactions, that might lead to mental health problems as well, because they might end up being isolated. So on that individual basis, I think it's a good place to start and say, what are you comfortable with in terms of moving forward and meeting, and just being aware that others might not be. And that would be the same also for employers. So come June, if you imagine, we're going to be in a situation where, as I said, most of our lockdown restrictions are going to be lifted. Employers might, feel that that's the time to bring all your employees back. But I think it's worth, if it, works for the business model, just to consider that a little bit and, maybe ask employees who's comfortable to come back and what are you comfortable with? Is testing going to make you more comfortable wearing masks, social distancing still, flexible working? What is it that will make you more comfortable and make you basically feel comfortable socially, which will help your mental health and help your physical health? So basically to consider that, because if you have employees who are healthy, and going back to that definition from the WHO, that means comfortable with your physical, mental and social well-being. So if you have healthy employees, they're going to be happier, and by default they're going to be more productive at work. So it's it's a beneficial cycle for both parties to look after everyone. I hope that made sense.
Yeah, complete say. So I mean, here the solution is to engage with your employees and actually listen to them. Definitely survey them, see what they actually need, and then obviously whatever there is required, and support them as much as you can, so that doesn't have any impact on their productivity, as it will have an impact on anything, but in their own health. So yeah, totally. Thank you so much. This has been so insightful. Thank you for you all for listening, and certainly tell your friends, and remember this week to put yourself and your health first. Thank you, Dr. Katrina.
Thanks, Lucas.